Chapter 3. Why Shared Decision-Making with Young People. Shared decision-making is important when working with adolescents and young adults because it helps them develop decision-making skills as well as other skills needed for being an active member of the care team. It ensures they will have a voice and a choice in decisions that affect their lives. Hi, my name is Pat Deegan. In this video, we will explore how shared decision-making is relevant for teams that specialize in supporting the recovery of young people with first-episode psychosis. I want to begin with a brief reflection. When I was 17 years old, I was diagnosed with schizophrenia. I was told I had a chronic disease and I would never be well. I was told to take high-dose antipsychotic medications for the rest of my life and to avoid stress. As a young person, the prognosis of a life as a chronic mental patient was devastating to my identity. For many years, my psychiatric diagnosis took on a master status, both defining and delimiting my sense of self. The prognosis of doom eclipsed my future, leaving me hopeless with no pathway into the future I wanted for myself. Instead, what loomed before me was an endless parade of hours and days, lost in a cloud of cigarette smoke, staring into space and doing nothing. In many respects, the despair I experienced was more disabling than the disorder. We don't have to repeat this terrible mistake. When we work with young people, we must communicate that recovery is real and that there is hope for a full and meaningful life after a diagnosis. One way we can communicate hope is through the practice of shared decision-making. When using shared decision-making, we invite young people to consider their options and to reflect on what matters to them. In effect, we invite them to consider an array of possible futures, and when there are pathways into possible futures, there is hope for recovery. For example, when using shared decision-making to explore school options, a young person must begin to imagine a variety of possible futures, such as taking an English composition course at a local community college, or doing an HVAC apprenticeship at the local technical school. Similarly, when using shared decision-making to explore medication trade-offs, a young person might imagine a future of not taking medicine, but living with symptoms, or taking medicine, but living with side effects. In addition to conveying hope for a meaningful future through exploration of options, the practice of shared decision-making also helps young people develop 4 skills that will help them successfully navigate behavioral health services in the future. First, shared decision-making invites young people to speak up during consultations. This helps develop self-advocacy skills. Secondly, shared decision-making encourages young folks to engage as active partners with the care team. This is important because increased engagement is associated with better health outcomes. Third, shared decision-making helps people feel respected because they have a voice and a choice in their care. And finally, shared decision-making helps people feel more in control, thereby supporting the emerging autonomy and self-direction of young people. I have witnessed another important benefit of shared decision-making when used by teams serving young people with early psychosis. Shared decision-making helps the team work more collaboratively during periods of medication discontinuation. As you know, coming to the decision to use or not use psychiatric medicine is typically a long and complex journey that involves trying medications, making trade-offs, and sometimes even rejecting meds. The notion of compliance and non-compliance oversimplifies the important deliberations that occur as young people grapple with the pros and cons and benefits and risks of using psychiatric medicine. Unlike the head-butting that so often characterizes the compliance-non-compliance discussion, Shared decision-making is a respectful way of walking with young people on their journey to discover if and how medicine will support their recovery. It does this by opening a third important option between using medicine and not using medicine. This third option is called watchful waiting. When a young person is choosing not to use psychiatric medications, the team can introduce the option of watchful waiting. Putting a time limit around the period of watchful waiting can be helpful. For instance, the shared decision might be to reduce a dosage or discontinue a medication for a month and then check back in to assess how things are going. Instead of doing nothing during a period of med discontinuation, the young person and the team can actively monitor what happens during a period of watchful waiting. Do symptoms get worse, improve, or remain the same? Do relationships get more stressful, improve, or stay the same? What happens to the young person's ability to keep up with responsibilities during a period of watchful waiting? A symptom tracking calendar can help organize these observations. Teams can encourage the young person to designate a trusted friend or family member who's willing to share observations during the period of watchful waiting. Here is the My Designated Observer worksheet. On the front, the young person can designate who they want in the role of observer. On the back of the worksheet, there is a template for the designated observer to share observations about symptoms, use of alcohol or drugs, ability to keep up with responsibilities, etc. There are two other important considerations when using shared decision-making with young people. The first is that cognitive processes associated with decision-making are still developing in younger adolescents. The second related factor is that family or guardians often attend appointments with minors, leading to what is called triadic decision-making or patient-provider-parent triads. The literature on shared decision-making with young people and family members is sparse when compared to what we know about adults. The literature we do have suggests the following. 1. Adopting a developmental perspective on decision-making is prudent. As young people develop autonomy in other areas of their lives, they will seek increased autonomy in healthcare decisions as well. However, despite their growing autonomy, several studies of young people with long-term health conditions have found parental involvement in decision-making is still viewed as desirable by many. 2. Young people want to be involved in decision-making, even if they do not make the final decision. Compared to decisions about surgery, young people have a higher preference for involvement in decisions about medicine, including whether or not to use it, route of administration, dosing, and the like. 3. In qualitative studies, young people complain of being left out of decisions or being talked about like they're not even in the room. It's important to direct comments and share information with young people and to solicit their opinions, preferences, and thoughts even when parents are in the room. 4. Parents sometimes try to limit information, especially about the risks of treatment. Young people with health conditions want information and are interested in talking with other young people who share similar life challenges. Use of the Internet to gather information should be supported, and teams should help young folks access credible information and decision aids when possible. 5. When it comes to factors that influence decision-making, data suggest parents tend to focus on long-term risks and outcomes. However, young people tend to focus on short-term quality-of-life factors, particularly side effects. Now, it's not always easy to reconcile the decisions young people and their families make. The Ottawa Family Decision Guide is a great tool to ensure both the parent and the young person have a chance to review options and share what matters most with the team. We will review the Ottawa Guide in more detail later. In closing, there's no doubt shared decision-making is a critically important approach for teams working with young people and their families. You'll find more resources, a self-quiz, and discussion questions to enhance your understanding in your viewer's guide. This is Pat Deegan. Thanks for listening.